Greetings to everyone, and you're all welcome to our today's discussion in medicine. So today we're going to talk about cerebral vascular accident with me, Sunday Sngalamba. Okay, so the stem of the question reads, Mr. Daka, aged 58, and the manager of a reputable bank, is admitted to your ward in a disoriented state. Following investigations, a diagnosis of cerebral vascular accident is made secondary to hypertension. So that was the stem of the question. Like I always mention, it is very important, it is very critical that you understand the stem of the question before you start attempting the questions. Do that in all the exams. It is very important that you do that. So question A, it was saying, define cerebral vascular accident. So now, how do we define this condition? How do we define cerebral vascular accident? In my definition, I'm saying cerebral vascular accident, basically this is just a condition in which there is an interruption of blood supply to a part of the brain, resulting in what? In oxygen deprivation. And it is mainly characterized by paralysis, altered level of consciousness, and also disorientation. So that is the definition of CVA. So one important thing to note in this definition is that in cerebral vascular accident, there is an interruption of blood supply to a part of the brain. That is the main important point that your examiner could be looking for. So it is very important that you mention that in your definition. Question B, it is saying, explain two major types of cerebral vascular accident. So what are those two major types? So stroke or CVA can be classified in two major categories. What are those categories? We have ischemic and we also have hemorrhagic. These are the two classifications of cerebral vascular accident. So now, what do we mean when we say ischemic CVA? So ischemic CVA, basically this one, it is a form of stroke that comes in due to an interruption of blood supply to a part of the brain as a result of a blood clot within a blood vessel. So that blood clot could either be a thrombus or an embolus. Yes. Then when we talk about hemorrhagic stroke, hemorrhagic stroke, basically this one, it is a type of stroke that comes in due to a rupture of a blood vessel that will eventually prevent the blood flow to a part of the brain. So in most cases, hemorrhagic stroke, it comes in following hypertension. Yes. So amongst these two types of CVA, the commonest type of stroke, it is ischemic stroke. It is very common. It contributes to about 80% of all cases of CVA. Yes. Talking about the predisposing factors, question C. Question C, it was saying, state 5 predisposing factors of cerebral vascular accident. So what are those predisposing factors of CVA? We cannot talk about CVA without mentioning hypertension, because it is one of the major causes of stroke. The second predisposing factor, we could also talk about what? Diabetes mellitus. We know to say DM, it may bring about atherosclerosis. So that one, it is the one that will eventually bring about stroke. The third predisposing factor that I would also mention, we could also talk about obesity. Yes, obesity, it is another predisposing factor of CVA. Cigarette smoking and alcohol intake. These are also social factors that may bring about CVA. Living a sedentary life, it is also another predisposing factor of cerebral vascular accident. Final but not the least, I could also talk about family history of CVA. It is also another predisposing factor. Yes. Then question D, it was saying, outline the medical and nursing management of Mr. Daka from admission until discharge. Yes, that was the question. The question was asking us to outline the medical and nursing management of Mr. Daka from admission until discharge. As usual, we always have to start with the aims. So what are our aims? The first aim is to resuscitate the patient. Yes. The second aim, it is to minimize cerebral damage. The last aim that I could also mention, it is to prevent further complications. Yes. So these are our aims for the management. Okay. So now coming to medical management, as usual, we have to start with the diagnosis or investigations. So what are those investigations? On the investigations, I could say history taking, it is very important. Physical examination, it is very vital. In addition to that, we could also do a CT scan. Yes, computerized tomographic scan is very important, very vital in a patient with CVA. Magnetic resonance imaging, MRI, it is also recommended in ischemic stroke. We can also do cerebral angiography. Yes. So this one, it will localize and also evaluate the bleeding site. We can also talk about that. Yes. Then on the treatment, coming to the treatment, we start with resuscitation first. Remember resuscitation, we follow the A, B, C principle. Airway, breathing, and circulation. We have to maintain that. The drugs, what drugs are we supposed to give in this patient? What sort of drugs do we give in this patient? So in here we give anticoagulants. An example of that, we can give aspirin. We can also give heparin or warfarin. Yes, we can give these drugs. In addition to that, we also have to give antihypertensive drugs. Yes, such as enalapril, captopril, nifedipine, furosemide. We can give any of those. Oxygen, it is also a drug. We can all give that if the oxygen saturations are below 95. Question E, it was saying outline 5 points you would include in your information, education, and communication on what? On discharge. Yes, so what are those vital points that we need to talk about? We need to talk about adherence to medications. Yes, the patient has to be taking the medications on time as prescribed. Talk about review dates. Talk about diet. On diet, make sure that this patient takes low sodium diet because the patient is hypertensive. So we have to ensure that we manage hypertension. And we can also talk about hygiene. Yes. So these are some of the important points that you have to talk about in your information, education, and communication to the family members and to Mr. Daka. Yes. So on that note, we come to the end of our day's discussion.